Clear aligners, the cost, the process, and do they work? Here's what you need to know. So a quick review. Invisalign, Spark, Smile Direct Club, all of these are essentially clear, removable trays that move the teeth by slowly applying pressure to get them to move where we want them. Number one, how much do they cost? That's what everybody wants to know. So prices will range typically anywhere between $2,500 even up to like $7,000. So what determines the actual cost within that range? Well, the cost is determined by how many trays it takes to straighten your teeth. Essentially, the cost is prorated based off of how many trays it's going to take to get the results that we want. I tell patients it's like this. There's basically different tiers, like almost a small, a medium, and a large tier. So to give you an example, a patient who has like some minor crowding, maybe some minor rotations, nothing that's too complicated, will take too long to fix, they're gonna be at the lower end of that price spectrum, maybe around like $3,000. So the more severe cases, the more severe crowding, rotations, complexity of the bite, the more trays that are required, these complex cases start to increase the cost and are the ones that usually end up being around $6,000 to $7,000. They require just a little bit more than those simpler cases, but they're not full-blown complex cases like their higher costing ones. So does insurance help? So we actually have a lot of patients who do have an ortho benefit in their dental plan, and sometimes it can cover up to $3,000, or even if it's not that much, whatever it is, it could help ease your financial burden to get the straight teeth that you want. Of course, these plans will vary between individual patients. So number two, what is the actual process like? So first things first, you'll have a consult with your dentist, your orthodontist, and they'll give you a general kind of idea, price range and time frame wise, how long it's gonna take. And then they'll take photos and digitally scan your teeth to get all the records they need. After they have all the records they need, it's time to deliver your tray. So then you'll go back to the office, they will put the buttons or attachments on your teeth, were essentially like little miniature fillings that we put on your teeth that your trays help hold on to. Kind of like these. So now that you have your trays, you're supposed to wear them between 20 to 22 hours a day. Really, you're supposed to be wearing them around the clock, except for when you're eating, drinking, or brushing your teeth. So how long will you have to wear the trays? Well, it all depends on how many trays are required to get the results that we want. So remember those easier or small level cases I talked about earlier? Those cases in general, I tell patients to expect anywhere between maybe around 6 to 8 months max to get everything straightened the way we want it. The middle of the road patients, maybe around 8 to 12 months. And then the more complex patients, generally I tell them expect to be wearing the trays for at least over a year, maybe a year and a half. Once you're finished with your treatment and you're happy with everything, and the teeth look the way that we want them to look, and make sure that you're happy with it. And if there's something that you want tweaked, fine-tuned, ask your provider if that's something that they could do, because a lot of that should be built into the pricing for you to make sure it's just how you want it. So assuming the teeth are where we want them to be and we're happy with everything, we will remove the attachments and it's time to get your retainers made. And then your provider will instruct you on how long and how frequently they want you to wear the retainers to keep everything in place the best that we can. So number three, do they work? In general, yes, but here are a couple things to keep in mind. You have to wear the trays consistently for your teeth to actually move. Now, this is super important because the teeth will only move if you're diligent and consistent in wearing your trays. Now, if any of you guys are parents or exploring doing this for your teenager or your kiddo, be sure that they're committed to wearing the trays consistently, because I have had some patients who have gone the clear aligner route for their teenager and they didn't wear them and it ended up being, yeah. There are some cases that are a little bit more complex where the clear aligners may not do the job that we need them to, and just the good old traditional brackets and wires are what are needed. Lastly, can you do the clear aligners without seeing your dentist? Really what I mean is like the do-it-yourself programs. So my personal non-biased opinion is that it's gonna be a better investment of your resources to have your dentist or orthodontist do your case. I know what you're thinking. Well, of course you guys wanna do it because then that's how you get paid. Now, I'm all for patients saving money, and I want you to save money wherever you can. But I have had a lot of patients who have done the do-it-yourself programs, and some of them have been, yeah, okay, the results were all right. But I've probably had more patients do them only to not get the results that they want, only to then basically have us end up doing it, and in the long run, it ended up costing more. Because at the end of the day, whether you're doing them at our office or with your dental provider, I'm quite certain that they will want to make sure that you're happy with your results and feel like you got your money's worth. So I hope that video provided some insight for you as far as the costs, the process, and do they really work. In general, guys, straighter teeth are healthier teeth. They're easier to clean. Your bite should be improved with them, and there's a lot of benefits to actually going through and straightening your teeth. Of course, one of which being you being able to smile confidently. If you got some value out of that video, be sure to give us a thumbs up and consider subscribing to the channel. Thank you for your time.